Healthcare is one of those career paths where we can always find entry-level work-from-home jobs. Even with the threat of AI creeping in, there really are plenty of opportunities available, and they're not all patient-centric. Today, I have 5 entry-level healthcare jobs you can do from home, and they're hiring right now. The first one I want to share comes to us from the company Ventra Health. They've been around since 2021, and what they do is provide revenue cycle management services for healthcare facilities. Basically, they do the back-end office work such as medical billing and dealing with insurance companies. They're looking for a provider enrollment specialist. This job is full-time remote anywhere within the United States. I did not see any location restrictions anywhere on this job description. So in this job, you're going to work with the provider enrollment manager to identify provider-payer enrollment issues or denials. Using a variety of proprietary and external tools, you'll research and resolve payer issues. So in this job, you will contact clients, operations personnel, and centers for Medicare and Medicaid services via phone, email, or website to do the research and resolve issues. So as you can see, this job is not patient-centric, but you will have to contact other parties. And you'd be a good fit for this job if you have an associate's degree. They prefer you have a bachelor's degree, but that's just preferred. It's not required. They also prefer you have a little bit of provider enrollment experience, and that too is just preferred. It's not required. Now, even though this experience is just preferred, it's not required. Even if you have a little bit of this related experience, awesome. Make sure to include it on your resume. If you do not have any of this experience, what I recommend doing is an internet search. Get as familiar as you can as to what it takes to do provider enrollment. That way on your resume, you can say, yeah, you are at least familiar with doing that kind of work. They'd like you to have a working knowledge of specific application requirements for Centers for Medicare and Medicaid Services, state Medicaid, and all third-party payers, including prerequisites, forms required, form completion requirements, and supporting documentation such as DEA, CV, and regulations. And again, here you can do an internet search, get as familiar as you can with all of those things. You also need a working knowledge of physician HIPAA privacy and security policies and procedures. And then you need all your typical soft skills you need for just about every job, including you're able to exercise sound judgment and handle highly sensitive and confidential information appropriately. And as far as the salary, they don't share that anywhere on this job description, but based on my experience looking at similar roles, I have a feeling this job could pay around $18 to $20 per hour. But there's no way I can guarantee that's how much you'll make in this particular job. You'll have to work out your salary with them. And as we go up to the top of the job description, they tell us this role is eligible for the company's performance-based incentive plan. So the next entry-level work-from-home healthcare job is also with Ventra Health. This one is for a chart research specialist. It's full-time remote anywhere within the United States. I did not see any location restrictions. And this one too is also eligible for the performance-based incentive plan. So that's really cool. On top of your salary, you possibly could get a bonus. So in this job, you'll be responsible for reviewing medical records for the necessary documents for proper indexing. Basically, you'll ensure medical records are complete within the electronic medical records system. You'll identify and obtain any missing chart information, including signatures from physicians and other pertinent personnel. You report on incomplete medical records based on the deadlines given, conduct review of systems, exam HPI and MD notes, and retrieve existing medical records from electronic medical records system. You'll scan and input documents, verify that information is indexed appropriately, pull down medical records through automate tasks. And if you're not familiar with automate tasks, maybe do an internet search, get as familiar as you can with automate tasks. You'll log into hospital systems and download registration logs and demographic data, document work processes, create new entries and subfiles as needed with correct medical record number, and monitor the performance of the automate tasks. Again, get familiar with automate tasks. So if you have a high school diploma or a GED and maybe a little bit of experience handling patient health information and or medical records, check out this opportunity. And you know what? That little bit of experience is just preferred. It's not required. They'd like you to have a working knowledge of medical terminology, anatomy, and physiology, as well as legal aspects of health information. And if you're not familiar with any of that stuff, in the description area below this video, I have a link to a really good free resource where you can pick up that information. You have a working knowledge of department roles and responsibilities, as well as knowledge of electronic medical records. And then you need all your typical soft skills you need for just about every job, including strong supervisory management skills. And when it comes to the salary, this job is not sharing the salary anywhere on this job description, but based on my experience looking at similar roles, I have a feeling this job could pay around $20 to $25 per hour, but you'll have to work out your salary with them. And remember, you have the potential for a performance-based incentive bonus. So next up, we have a billing specialist job with Included Health. So Included Health is a digital healthcare company that's been around since 2011. And this billing specialist job is full-time remote anywhere within the United States. I did not come across any location restrictions as I scanned through this job description. And what you're going to do in this job is all things related to generating invoices and making sure payments are applied correctly and promptly, as well as open balances are being researched and follow-up on, and customer accounts are maintained with a high level of accuracy and responsiveness. They tell us this role is well suited for someone with early career experience in billing, accounting, or accounts receivable, and you're detail-oriented, organized, and comfortable building cross-functional relationships and working across multiple systems and spreadsheets efficiently. So that pretty much sums up this job. They have more details. If interested, read through the details. Now, they tell us they prefer you have a bachelor's degree in accounting, finance, business, or a related field, and they'd like you to have a little bit of experience in billing, accounts receivable, cash applications, collections, or a related finance operations role. You have experience working in a high-volume, detail-sensitive environment, and you're familiar with invoice generation, reconciliations, payment application, collection support, and issue resolution. You're also comfortable using Excel. You can work across spreadsheets and multiple systems, and it's a plus you have ERP experience as well as Workday experience. And as far as the salary, it looks like they'll pay you anywhere from $22.79 up to $29.83 per hour. And if you live in the more expensive to live areas, you can possibly earn more than that. So moving on, Coral Health, a revenue cycle management company that's been around since 2020, is looking to fill a position for an appeals management coordinator. This job is full-time remote anywhere within the United States, and you'll work Monday through Friday, 8 a.m. to 5 p.m. Eastern time zone hours, but you don't have to live in the Eastern time zone. Just translate your local hours to those hours. So your main responsibilities in this job include using the phone. You'll perform denial research and follow-up work with insurance companies to resolve appeals that have been submitted but remain without determination. You'll compile multiple documents into appeal bundles and submit appeal bundles to payers in a timely manner and determine document appeal timeframes and payer processes. You'll transcribe information from clients' EMRs and payer portals into required electronic format and check completed work for accuracy. You'll also monitor and complete tasks within shared inboxes and internal request dashboards, and follow up with the client or internal staff via email or phone for additional information as requested. So they're looking for someone who loves communicating with others over the phone, but don't worry, this is not a customer-centric based position. You will have to talk to other parties to get additional information to complete the appeals process. You're comfortable using computers and you're able to schedule meetings and log on to Teams for meetings. You're comfortable using Excel. You can type at least 25 words per minute, and you can strictly adhere to HIPAA and high-tech compliance. And then, of course, you need your typical soft skills you need for just about every job. Now, they'd like you to have a high school diploma or equivalent, and they prefer, but they don't require, they prefer you have a bachelor's degree. You can understand denials processes for Medicare, Medicaid, and commercial and managed care product lines. They prefer, but don't require, they prefer you have prior experience accessing hospital EMRs and payer portals, and you're comfortable using Microsoft Office products. And as far as the salary, they're not sharing that anywhere on the job description. So I did a little bit of research, and it looks like Coral Health has paid for this position anywhere from $18.25 up to $28 per hour. I can't guarantee how much you'll make in this job. You'll have to work out your salary with them. So our last work-from-home entry-level healthcare job is also with Coral Health, and this one is for an insurance follow-up specialist. This job is full-time remote anywhere within the United States, no location restrictions. So what you're going to do in this job is resolve unpaid and denied claims by leveraging proprietary software system. You'll make phone calls, generate letters, access client systems, and insurance carrier web portals in the pursuit of getting a claim resolved. You review medical documentation to determine the appropriate course of action for claim resolution while staying familiar with client preferences and known issues. And it goes without saying you need to do this job while complying with HIPAA privacy laws. So if you have a high school diploma or equivalent, you're comfortable using computers, and you can work efficiently in a remote environment, check out this opportunity. Now, you do need to be a good communicator and you have basic math skills. And they prefer, but they don't require, they prefer you have a little bit of physician and or hospital accounts receivable experience. They also prefer you have knowledge of UB04 claims forms, EOBs, and medical records. And they prefer you have a little bit of EMR experience. They're not sharing the salary for this position, but it looks like they have paid anywhere from $39,000 to $63,000 per year with an average hourly pay of about $25.98 per hour. And again, you'll have to work out your salary with them. So those are all the entry-level healthcare jobs I have for you today. Hopefully one of them works out for you. And if you're looking for some no experience needed work from home jobs, you can find some in this video right here. Thank you so much for visiting. I truly appreciate your support, and I'll meet you on the next job lead.